Carotid Endarterectomy. Introduction.
Can you point to the carotid artery?
Choose one of the following options.
Correct. The carotid artery carries blood from the heart to the head through the neck. A stroke happens when blood flow to the brain is interrupted.
Select true or false.
Correct.
Which one of these arteries has plaque in it? Choose one of the following options.
Correct. The inside of this artery is narrower, so it lets through less blood. Some plaque can break loose and clog an artery in the brain.
Select true or false.
Correct. Such clogging can cause a stroke. Are heart attacks and other anesthesia-related complications common during and after this operation?
Select yes or no. Correct. Anesthesia is very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections common after surgery? Select yes or no. Correct. Infections are rare. Though rare, infections as well as bleeding and scarring may occur.
It is impossible to injure the feeding tube or breathing tube in this operation.
Select true or false.
Correct. It is very unlikely, but not impossible, to injure the feeding tube or the breathing tube in this surgery. Such injury could cause hoarseness.
Paralysis and strokes are frequent during and after carotid artery surgery. Select true or false.
Correct. Strokes or paralysis are rare in this surgery. Although these risks are rare, they can still happen. This operation tends to be very successful.
Select true or false. Correct. The operation is successful, but complications may happen. Thank you for using Explain.